I think this last portion of our time today is important because it really rings home why I do what I do and why many of the people in the room who you've talked, who have spoken today do. And as one of I wanted to introduce our other partner here today, and that's WomenHeart, the National Coalition for Women with Heart Disease. You've kind of heard about WomenHeart, and I've been involved with WomenHeart, and introducing Lisa Tate, who is the Executive Director. She's worked in public affairs for more than 25 years, and she joined WomenHeart as Executive Director in 2007. And prior to that, she'd spent 14 years at the National Association of Children's Hospital and Related Institutions as Vice President of Public Affairs. So Lisa's going to tell us a little bit about why she does what she does and the importance of the patient.
Exactly. Thank you, Sharon. I just wanted to talk just for a couple of minutes today to talk a little bit and put in context what you're going to be hearing from our wonderful WomenHeart Champions, who are the patients going to be speaking here in just a few moments. But our organization, WomenHeart, the National Coalition for Women with Heart Disease, is the nation's only national organization that's solely focused on women with cardiovascular disease. Our goal as an organization is to ensure that every woman has access to prevention, early detection, accurate diagnosis, and proper treatment. And we primarily work in three areas: education, patient support, and advocacy. And in fact, today at this meeting, two of those main components, I spoke about the third one, that advocacy piece from the floor a minute ago, are really well represented. You know, in terms of education, we work like any other national organization in a myriad of ways through our website with 50,000 visitors a month, or through printed materials, getting the word out to women and patients. We distributed 1.2 million pieces of printed materials just last year alone. So we do all those regular kinds of things. But what is unique about our organization is that we are truly a grassroots, community-based organization. And that is through our unique flagship program, which is called the Science and Leadership Symposium at Mayo Clinic. That program, which is now going into its 10th year, celebrating its 10th year this year, is truly unique. It is a program where patients, women from around the country, all who have heart disease of some form or another, apply in a competitive application process to come to this program. And we have several hundred applicants every year, of which we choose around 60 to 70 to train and go through this almost 5-day intense training program where they get a crash course in the science and medical aspects of heart disease at the Mayo Clinic. It's all held at the Mayo Clinic, primarily with faculty from Mayo, but also almost every one of the physician speakers who's been with us today has taken part in the program at some point over the last 10 years. They get the science and medical aspects, but then they're also trained in public speaking, a full day of media training, and in community outreach strategies, with the goal of they then go back to their communities and are able to tell their own very personal stories, as you'll hear in a few moments from our WomenHeart Champions. That's what we call them when they graduate from the program. Go back to their communities and educate other women. They speak at anything from something as small as someone's book group to as large as the Texas Conference on Women. And, you know, this program was based on the premise, and the premise has definitely proven true, that really nothing makes a woman sit up and listen and take notice and hopefully take action than hearing a personal story from another woman who has been there. And, you know, you'll be hearing more of that today. What I can also say about this program is that it certainly would never have been possible at all without the personal commitment and leadership and everything from Dr. Sharonne Hayes and the Mayo Clinic as a whole. I mean, Dr. Hayes is the medical director for this program. She's also a member of the WomenHeart board, so we're involved on a day-to-day basis in leadership of the organization. And I know that she knows, and all the physicians in the audience know, that you save lives, and she saves lives, you know, really every day in her clinical practice. But I don't know if she would have known when this program started 10 years ago that that would be another way for her and our champions to save lives. We have done surveys of our champions in their speaking, and 45% of them our volunteers have been directly credited with saving someone's life by talking about signs and symptoms, you know, particularly of a heart attack, and then hearing afterwards from someone who, you know, said they would not have known they were having a heart attack, or they would not have known to aggressively push for that second opinion if it not had been for what they heard from these champions and what they learned in this program at the Mayo Symposium. So I think that's a pretty amazing number, considering those are the ones that they've heard from. I mean, Carol spoke, our board president here, Carol Allred, spoke at the Texas Conference on Women a couple of years ago. And, you know, who knows how many people she touched that she'll never hear from. But she has just a fabulous story about a woman who came to her after the program in tears and said that she had talked to her mother that morning on the telephone, and her mother was was ill. And as this woman heard Carol speak, she texted her father and said, take her to the emergency room immediately. I think she may be having a heart attack. And that was only because she'd heard Carol describe what those symptoms are. So that's the kind of work that these wonderful women are doing at the grassroots level every day, and that Sharon has made possible through this program. The other part of our program, the patient support aspect, you also have a sample of that with you today. This red bag of courage here that's at the table, and I'm just going to grab that really quickly. But each of you will be going home with this. Our organization has also found it, you know, it's so important for women to be able to connect with other women who have heart disease, and to see that they can also live a full life despite their heart disease. So that's another important aspect of what our organization does. But one of our programs is called the Heart Scarves program. And it is an actual scarf that you'll see here where women receive this in the hospital or after they're newly diagnosed as a token of warmth, friendship, and the community that is their heart sisters, the many women around the country that do experience heart disease. And then they are connected with our organization. So what we ask for you today is, after you go home, is to remember, take this red bag of courage, read the educational materials, and then give this heart scarf and pass it on to a woman who has been touched by heart disease. Because unfortunately, we know that really every single one of you will know someone, or has known someone, or knows someone right now who's been touched by this disease. So without further ado, I'm going to turn it back to Sharon and then our wonderful champions.
Thank you, Lisa. I must say, I'm always humbled when I sit with patients who are going to tell their story, because often we physicians are looked at as educators for our patients, but I will say that particularly interacting with patients who are not my patients, who probably wouldn't be as honest with me about things, has taught this cardiologist more than I think I would have known in many other ways. And some things that are both very enlightening but also disturbing, and have helped me become a better doctor. We know from here there is no shortage of women with heart disease. In fact, the number of women with heart disease in the 35 to 55 age group is not dropping. It is for men, and for older women and older men. But that is, as we've heard today, that is just a really important time. And I think that you'll hear stories from the women today who will help you understand what are the actions that we need to do to make those statistics change. We haven't had enough scientific and media attention. I mean, Barbara Walters accepted, but again, there aren't as many women. Even when she had her special, the people she interviewed were other men who'd had heart disease, and I think that disappointed some of us in the advocacy community as well, and I think we just need to keep putting that face on heart disease. The Institute of Medicine tells us that we have to think about sex and gender in everything we do, from womb to tomb. Well, we've talked about womb today, and we're not going to talk about tombs much. But I think that the misperceptions are going to continue unless we do look at sex and gender and its effects on heart disease, whether it's research, whether it's behavioral modification, because women are different. And I don't think we needed a scientist to tell us that today necessarily. We are making progress. As was touched on in the last panel, one of the big things that we have that would be an early win is translation. We know a lot about there's still a lot we don't know, but we do know a lot. We know a lot about treatments, we know a lot, and their effect on women, about prevention, and we don't do a great job of translating the fantastic research that we do into everyday life. There are delays getting it into the hands of doctors, and delays then further in getting it into changing behavior in patients. So I think that if we can take anything away, it's applying what we know, because that's something, whether it's using guidelines or others, that will raise the bar. One of the things that was alluded to by Dr. Cook about adherence to guidelines, what we find is there's a lot of things. Say you've got a drug that you're supposed to use in a heart failure patient, and we're not using it enough. I can tell you if we're not using enough in women, we're using it less well enough in women. And you implement one of these programs where everyone is doing checklists and they make sure that everyone gets this drug, the care for men improves. But the care for women actually usually ends up, because they're doing a checkbox, equal to men, so you actually disproportionately help the women. So I think those things which help us do best practices and follow guidelines will be helpful as well. And I think finally, making sure that women take their symptoms seriously and call 911 and don't miss a beat. And we've got, I'll put another plug into that, because there's a lot of confusion around symptoms. And women who have symptoms and identify symptoms would tell their husband to go, they'd call 911 for their husband, and they finish cooking dinner for themselves. So that's the thing, not for themselves, but for their husband and family and themselves, before they call 911. But I do think that things have really changed. I've been practicing medicine for over a quarter century, and I've seen so many more things in my little black bag or little red bag or whatever I'm going to be carrying tonight or this week to the fashion show. But I think that it's really going to be the patients that are going to help us take it to the next level by talking and making real this disease, just like the breast cancer advocates have, that it has really, and we are looking to how to make this a women's disease that everyone can rally around. Today we're going to hear from some women. I'll have our panel come up. You in the media know how powerful storytelling is, and that we hope that Nadine and Brenda and Diane and Maxine will inform and inspire, and all are WomenHeart Champions, which means that they have gone through the training program at Mayo. And I'm just going to introduce them down the line. Diane Mcdaniels, she's lived with heart disease for the longest time. She was diagnosed when she was pregnant, so that brings with our first panel at age 19, her first pregnancy, when she went into heart failure. She was hospitalized for 5 months during her pregnancy because she had a narrowing of her mitral valve called mitral stenosis due to rheumatic heart disease. And she's had several operations. She ultimately had her valve replaced. She's on the Coumadin blood thinner and has had 4 TIAs from blood clots related to heart rhythm abnormalities. But in between all of this, she became a lawyer. She works at the New York City Department of Aging, helping other older people find the appropriate health care. I loved, Diane has said that heart disease, because she's lived with it for so long, it's shaped her in some ways, but it's not defeated her aspirations to excel personally or professionally. She has grown children, and her daughter, Tamiko White, is back there taking pictures of her and a family member thing. Nadine was diagnosed with mitral valve prolapse, as Dr. Suri talked about, when she was 18, but then she had palpitations, but ultimately had ventricular fibrillation diagnosed, which can result in death. And so she had a defibrillator implanted, which she's had to use on several occasions, or it's resuscitated her. Most recently, I think in 2009. She's been diagnosed with cardiomyopathy, or a weakening of the heart muscle. She works full-time. In the past few years, she's gotten her master's. She's working on her PhD in health science. She's been very active in advocacy and wants to put a face on heart disease. And her husband, Wesley, is with us here today, and she has 2 sons and 2 daughters who've been very supportive. Brenda, she had undiagnosed symptoms for a while. I mean, you really were challenged, saw a lot of doctors, and finally, when she woke up on the kitchen floor after falling and being unconscious, that's when sort of people started taking things seriously. And she's subsequently been diagnosed with a number of arrhythmias. She has a pacemaker. She has to take medication. She's had ablations, which is where they're trying to treat heart rhythm abnormalities. She's done all this while being a college professor and raising a couple of children. Her son's autistic, which has presented its own challenges with her diagnosis, and has to live daily with cardiac symptoms. And she has really credited her friends in helping her get through this. And one of them is Angela Reed, who is here today. Thank you for coming and being here, Angela. And finally, Maxine. She's a high-powered corporate banker. Looks are deceiving, but she is. But 15 years ago, at the age of 41, she had a heart attack at home. It was quite sudden in onset, and we'll have her tell about how she recognized those symptoms. She was treated with angioplasty and clot-busting drugs. Her children were ages 5 and 10 at the time. And she went through cardiac rehabilitation medication, and she really thinks that the healthy lifestyle that she has lived since then has really helped her recover. She has a family history of both breast cancer and heart disease, and family history is important. She's kind of back to being superwoman, and that's what her children and her husband say. Her kids are out of the house, and she's working harder than ever and continues to advocate. And her mother, Shirley Schultz, who was a former CBS employee, so that was her connection to this room, and I guess, and her husband, Jacob, are here. So I think it's a big step to talk about your story, and particularly your heart disease story. And I remember all of you when you were in Rochester that first time talking about it. Sometimes it really was the first time you told the story. And I think, what was it about, and I'll let any of you jump in, but the diagnosis, and maybe your diagnosis, Maxine, was sort of one of the more dramatic. And what were you thinking?
Well, in my case, I was concerned about breast cancer all my life, and the fact that I had a strong family history of heart disease didn't seem to connect, and I had a bad lipid profile, and the doctor gave me a pill for that. So what was the problem? I had no real concern about heart disease. My doctor didn't say, you're at risk, take this seriously. So, but I woke up one night in the middle of the night nauseous, you know, had vomited, went back to sleep, woke up again, and when I was having dry heaves, all of a sudden, I remembered my aunt's story about not feeling well, calling her husband's cardiologist, and he said, what did you have for lunch? She felt nauseous also. He said, what did you have for lunch? She said, a corned beef sandwich. He said, well, it's the corned beef sandwich, and don't worry about it. It'll pass. It didn't pass. My cousin showed up, said, what's wrong with you? Doesn't look like a corned beef sandwich. Took her to the ER, and she was having a heart attack. The second time I woke up, I remembered the story. Woke up my husband, who looked at me and said, I said, you know, I know this sounds crazy, but I think I'm having a heart attack. And of course he said to me, have you lost your mind? I was 41 years old. I said, I don't know, maybe, but call 911, which is what we did. And luckily, the EMT arrived. I was flipping T waves. It showed up right away, and I got the right treatment, which brings me here today.
Diane, you were so young. Yeah. I mean, I can't imagine. You've got your first pregnancy. It's supposed to be a happy time, and you landed in the hospital. How did that change things for you?
Well, I was in shock that I even had anything wrong with my heart. I never had any symptoms before. I was active. I played basketball. I ran track. During my pregnancy, I would get short of breath and be fatigued, and I would wake up at night, short of breath, catch my breath, go back to sleep. And one night, I could not catch my breath. And when I went to the doctor, I had an appointment. So even though this was happening, I was like, oh, I got an appointment next week. I'll wait till next week and tell the doctor when I go. So I go to the doctor, and I'm having my checkup, and the doctor says to me, okay, Ms. McDaniel, can you wait here? I want to bring in another doctor. And then he comes in, and And they kept asking me, have you ever had rheumatic fever? And I told them no, because I didn't know if I had. So they brought in another doctor. He asked me, did you have rheumatic fever? So he brings in another doctor, and then they say they want to bring in a specialist. Well, they went out of the room, and I put my clothes on. And when they came back in the room, I said to the doctor, if you don't tell me what you think I have, I'm leaving. And they said, we think there's something wrong with your heart. I was in shock. And they said, and what you have can only come from rheumatic heart disease. And have you ever had it? I told them no. And that's a disease you get in childhood. And basically, from what I've learned, is that it can scar your valve in your heart, and they give you antibiotics, and you outgrow it. Well, I never knew I had it. So the damage to my heart was even more severe. And now that my body was working for two people, it put a lot of strain on my heart. So here I am, 4 months pregnant, and they told me that they were going to have to admit me to the hospital. I went home. The next day I came back. They explained everything to me, and I went in the hospital. I had congested heart failure in my 8th month. I was in the hospital. However, that was triggered by an incident in the hospital because I was on strict bed rest. I was trying to make a deal with the doctor because I had things to do. I said, look, I'll go home. I'll stay in bed. I won't. He says, no, even if you sweep the floor, it'll put you at risk. He says, you have to come into the hospital. They put me on bed rest, and I was in the hospital with other women that had had difficult pregnancies, and they brought in a woman who was an epileptic, and they wanted her to be in the hospital when she was going into labor. And she started going into labor in the middle of the night, and I woke up. And because I had been in the hospital a very long time, I knew most of the nurses, and I went to the nurses' station. There was no one there. Well, I knew where they ate lunch, so I went back there, and that's where they were. And I told them, Mrs. So-and-so was in labor. I could hear her pushing, and she delivered the baby, which was very upsetting to me. And the next morning, I started throwing up blood. And so I went into congested heart failure. You know, everything went well after that. They put me in a private room, and when I went home, my daughter was 2 weeks old. There she is. So that was a major impact on me, not only because it disrupted my life, it was something I didn't even know about. I had a child I needed to take care of. Even when I came home, I had to have someone take care of my child. I could not do the regular feedings because I had to be on bed rest. We went through that, and for a long time, they treated me with medication. And for the first 7 years of her life, I was treated with medication. And one day, I went back to work, went back to school. I was working for legal aid, and I believe that day I had gone to the Bronx House of Detention to see a client. And when I came back to the office, I wasn't feeling good. And so anyway, I went home, and I went to see my doctor, and he couldn't find a blood pressure. The only symptoms I had was nausea and a headache. And he says, Miss McDaniel, we have to get you to the hospital. I said, I can't go to the hospital right now. I'm a single parent. I got to get to pick my daughter up from school. So I have to say that I've had, because my parents are no longer here, an exceptional extended family. I could call my family at the drop of a hat. They would pitch in, take care of my daughter. I went in the hospital. I had my first open heart surgery in 1970. I had my second one 10 years later, and 2 years after that, I had my mitral valve replaced. I've had 3 open heart surgeries. It's been a major impact on my life, my daughter. Needless to say, and I do get emotional, but needless to say, I have been able to have a good life. I watch my weight. I eat right. I don't smoke. I scream every now and then. But I have been able to, and thanks to WomenHeart, I've been able to connect with other women that have heart disease. And, you know, I'm here to say that even though you may have heart disease, you can still have a full and successful life.
Thank you.
So Brenda, you had, I mean, I think what we have heard here is that heart disease affects every aspect. It affects her husband, it affects her finances, her educational plans, her family plans. It affects psyche, self. And Brenda, particularly your children were young, and you were a single parent at the time as well.
Yes.
So tell us how, and you had sort of a definition of an extended family as well.
Well, my daughter was 13 and my son was 11. I was diagnosed, my doctor, the symptoms I presented were racing heart rate, fatigue, and lightheadedness. So I was being treated for anxiety and depression because, you know, when women have stress, they blame it on the kids and the men in their family, so they just considered it, that's what it was. And one day I just woke up on my kitchen floor. I had no idea what was going on. I went to the hospital and I was angry. I skipped over the whole shock. I was mad because it took 2 weeks for them to give me a diagnosis because I have sick sinus syndrome, which generally presents itself in women over the age of 65. So they had a very hard time diagnosing what I had. Then it took another 2 weeks to find a doctor who would take me on because these doctors would walk in with my chart and say, "Hi, I'm doctor," and look up and look at me, and then look at my age and turn around and walk away. So, and I couldn't find any research on people my age that have what I have. And my children, I really had to put up a good front from the time when they were home. I fell apart from 8 to 3 while they were at school. And I had to, you know, pretend like I was going to be okay. It was very stressful for them because they don't, and plus my son is autistic. Autistic children see things in black and white. Mommy has heart disease, which means mommy's going to die. So I kind of had to keep things, you know, kind of even-keeled for him. The one thing my daughter was 13, I had spent 13 years giving her an example and telling her, you can do anything by yourself. If you want a man in your life, that's fine, but you don't need one. I was out of work for a total of 10 weeks and I had to go on disability, and it was humiliating. So, you know, that kind of thing really, when you're educated, you've worked, you stand up on your own, you don't need anybody to help you. When you get heart disease and you have to ask for help, it's very, very hard. I'm lucky that my family does not live close to me. I'm lucky that I have a very large group of wonderful women in my life who took over for me to help with my children and to help with the daily things that had to be done in my life. But, you know, it's hard when you have to, all of a sudden, you can do anything you want and be anybody. And, you know, our mothers have all told us, we can have it all. And then all of a sudden, you have to ask for help, and it's very hard.
So Nadine, you had shared that you've sort of changed your lifestyle and what you do because you know that this heart stoppage, this ventricular fibrillation, could occur again. And even though you've got the backup plan with the defibrillator,
Right.
It was so striking because she says, well, I try not to excite myself because it bothers other people when I have sudden cardiac death.
I know. And I'm sitting here saying to myself, don't go off. Because everyone in here will freak out because what happens when you have a defibrillator and it shocks you, you literally go, well, mine is powered to where it'll make me unconscious for a couple of seconds. So if that happens, don't panic. It will bring me back in about 60 seconds. It takes about 30 seconds to charge. But I knew that I had mitral valve prolapse when I was 18. I had taken a physical for my first job out of high school. And, you know, the doctor told me, don't worry about it. It's no big deal. A lot of women have the mitral valve prolapse. Just take an antibiotic. You know, if you have to have surgery or anything like that. So, all right, fine. You know, I'm 18. I just go on and live my life and don't consider myself having heart disease or anything like that. And I got stuck in atrial fibrillation for about 4 days when I was just about age 28, which then prompted me to go and see a cardiologist who did a complete workup. She did a cardiac catheterization where she saw the scar tissue showing evidence that I had suffered a heart attack at some point in time. So I had a silent heart attack, not sure when exactly, but I did find out about that when I was just 28. And a couple years later, in the midst of a divorce, very stressful, moving into a new apartment, it was in the summer, I had what they call syncope, which I know you all know what that means, but I fainted and had to eventually see an electrophysiologist who then determined that I'm at risk for sudden cardiac death. I suffer from ventricular tachycardia, ventricular fibrillation. I have all the bad heartbeats that no one wants to get. I get those. I got the defibrillator put in 2003. Met my husband, got married in 2005. Loved him. I'm sorry, I'm going to get emotional. With me through the whole process. It happens sometimes. But you just keep pressing. Got involved with Women Heart in 2006. I'm sorry, give me a minute. I just need a piece of tissue. I cry about so many things. But, you know, it can be really, really emotional when you know that at any given moment you could just be gone. And Dr. Hayes, awesome. Love you for everything that you do. And all the doctors represented here, but we are the face of heart disease. You know, we are the people that you work to save. And, you know, we're fabulous, we're beautiful. But I'm sorry, I think that I am.
It's a lot. I think we are.
Well, we walk around and we live, you know, we try to live normally, but the risk is always ever present. So I'll stop for now. Let me get myself back together. And I'll come back in a few minutes down as we go.
I think one of the things that we've certainly learned, not just through science, but from talking to these women, is the effect and how common debilitating anxiety after a heart disease diagnosis and depression that is unrecognized and often not treated. And I think that at various stages in your life you had that. And Maxine shared about the anxiety that she really had to the point where she couldn't go to work really and depended on your mother.
Well, that was also. First of all, I would go from, you know, up a flight of stairs in my own home, clutching my nitros in my hand. You know, I was a woman who had traveled the world and gone off to live abroad all by myself. There wasn't anything that intimidated me. But now I was afraid to walk up a flight of stairs. And I was afraid, I didn't know how I was going to go back to work. And my mother, of course, said, you can do this. Let's go together. Took me by the hand, and we rode New Jersey Transit into Manhattan. And I was very lucky, and I think as the session goes on, you'll hear me say that many times. I was lucky. I recognized what was happening to me. I got the right treatment. After what happened, and I had major anxiety, but my doctors all recognized it. They said, okay, they got me 2 therapists, one to help me to deal with what had occurred and the anxiety. The other just sat there and would help me figure out ways to go back to work, to go back to the office, deal with the pressure and the stress in the office. These were all things that I needed to overcome. And the family pitched in. My husband took over the cooking, the shopping, the supermarket, all of those things. Even my 5-year-old, by the time he was a few years older, would make his lunch every evening for school. I mean, it was a family effort, an effort of friends, and that's how I got through it. I saw there were ways. I worked through it and was able to come back and believe that I could do things again.
And Diane, you had some depression after your surgeries.
Yes, I've had, well, like I said, I've had 3. The second one I had finished law school. I was studying for the bar, moving right along. That was my lifelong dream, that I wanted to be a lawyer. As a matter of fact, I have to say, once my first surgery, because I was going to wait until my daughter got a certain age, but after my first surgery, I said, Diane, if you want to be a lawyer, you better go to law school now, because you might not be here. So I did go. But after my second surgery, I walked into my doctor's office. Well, I had symptoms, and I was ignoring them because I wanted to take the exam. But it didn't work out. So my second surgery that I have to say, and I don't want to take too long, but the first panel, the doctor was talking about the mechanical robots doing surgery. The first time I heard that, I couldn't believe it. I said, it's fantastic. The first time I had surgery, they went up my left breast and up my left shoulder. I had to relearn how to use my left arm. I couldn't do it. 6 months recovery. The second one was down here. In 6 weeks, I was up and about. I was like, my God, well, it was amazing. The technology. In 10 years, I couldn't believe it. But my second surgery, a lot of my depression came from the fact that when I went to have my second surgery, I was supposed to have a mitral replacement. When I woke up, they had repaired my valve a second time. And I knew eventually I was going to have a third surgery. As the doctor said previously, they made a judgment call. You can't sue when they make a judgment call. It's not medical malpractice. She's a lawyer. They made a judgment call that they could repair the valve and for me to keep what God gave me as long as I could. So yes, I had some depression. I did go on medication, and I got through it. But it is very depressing to have your life going forward. And also, I had gotten over the shame of having a bad scar.
That's another thing.
I can relate
And
to that too.
I had gotten over it, and then again, I looked at my chest and I said, my God, now I got another scar.
Yeah, I relate to that because with the defibrillator, and you see I'm small up top, it sort of protrudes. So in the summer, you know, when you do the tube top, you know, you get the second looks and, you know, you have a scar as well, but, you know, you just kind of decide, well, this is, you know, my life. And you just sort of keep it moving. But another thing that you said, and I think you also mentioned, when you have those symptoms, because you're young and you're busy, you just sort of ignore them. Yeah. And I think it's really important for women to understand that you can't always, you know, continue with your everyday life, because a lot of times your body is sort of giving you that hint that there's something wrong, you know, with the most important organ next to the brain that you need to pay attention to. So I think that's really an important message to put out there, to not ignore what your body is trying to tell you.
So we've talked about all of the different impacts in your family and what you do, and Brenda, you shared that it was a funny but not so funny your effect on your social life.
Oh, well, okay, I'm 40, divorced, I have 2 kids, I'm educated, and now you're going to add in, well, I also have a pacemaker and heart disease on top of it. It makes men just turn and run. I think if there's more education out there, not only for the women, but for the men, because I went on a date and, you know, I put it all out there in front because I don't want them, you know, to be misled. And I had some guy ask me if I was going to die during dinner. You know, I mean, so I got up and took my coat and went home. But, you know, even if the men, you know, there needs to be more education. We have heart disease, but look at us. We're not going to fall off the couch and die right now, you know. We have lives, and, you know, we're vibrant women. We have a lot to offer people and a lot to offer to society, but it does add, you know, according to society, it adds another negative check to your list of the things that a you know, possible date might be looking for. But I'm fabulous too, so.
Absolutely.
I just want to add to that she's right, and as time goes on, things work out. I too am divorced, but I will be getting married very soon. So life goes on.
Life does go on. And with that, I think, on that kind of up note, because life does go on, doesn't it? And you guys are all fabulous. Are there questions from the audience that you'd like to share? And we'd like to capture those on the microphone if you do. Anybody want to? Elizabeth.
Yeah, so thank you all for sharing those moving stories. I just wonder, as you encountered the health system after the event, or are there some lessons learned? I know WomenHeart came into your life at different stages, but just think about women either before or after they encountered this wonderful organization. How would you advise them in you know, different physicians that you encounter?
Well, I'll take part of that one. You really have to be your own advocate, because like I said, when I was diagnosed, I couldn't find a doctor that was going to take me on as a patient, because I do the research. When I have to get my pacemaker interrogated, I'm going to stand right behind him and look at the screen. And it takes a strong doctor to take on a young woman, and a lot of times it's better if you get a doctor who's a little closer to your age, so that you don't have to, if someone's going to retire, then you have to go to another doctor, then another doctor, to another doctor.
I love the optimism. She's going to outlive all of her doctors.
I am. And I'm going to bug every single one of them every time I come in. And I bring in research studies that say, maybe this is what caused it, because I want to know the underlying factors. But I have a wonderful doctor, Francesco Santoni at Lenox Hill. I'm going to plug him because he walked in. I'm a complete type A personality. I want to know what's wrong, what are you going to do to fix it, how are we going to make sure it doesn't happen again. And he walked right into my room and told me everything I needed to know. And it was such a relief, and such like a cloud lifted. But you really have to be your own advocate. If you know something's wrong, then you have to just say, okay, something's wrong. If the doctor tells you no, either go to another doctor or go to the emergency room and say, there's something wrong with me, I need some tests to be done.
I just want to comment, I can't agree more. When I had my third surgery, my second surgery, like I said, I was depressed and disappointed. But when I had to have my third surgery, I did research, I consulted doctors, I became an active participant. I said to myself, I am no longer a victim. I want to know the doctor's history, I want to know what they're going to do. I did research, I reached out to other people that knew other cardiologists. I wound up at the Washington Hospital Center in Washington, D.C. They've done a wonderful job, and I've had my St. Jude valve for about 15 years now, and I'm doing fine.
I have a story where a year after my heart attack, I was just treated with angioplasty. I had two 90% blocked arteries, one 40% blocked artery at the time of my heart attack. They were only opened up to 240s and 110. And a doctor did a routine stress test on me and claimed that I had restenosis, blockages again, and that I needed to be stented immediately. Well, I was 30 pounds lighter, exercising religiously, following Dean Ornish. He was my Bible at the time. And I was floored. I was sure if that was the case, after 1 year of living like that, I was not going to see my 50th birthday. So I challenged it. I absolutely said, doctor, I just feel fine. I just can't believe this. And I went to other cardiologists. And with additional tests, it turned out that it was simply breast tissue and that I did not have restenosis. And luckily, I was not stented again. And it's almost 16 years since my heart attack, and I've been fine. Also, with meds, exercise. Can I throw that in now? I know I might not look the size 2 from the person who's exercising every day, but I was up at 5 a.m. this morning, and I spent 45 minutes on my elliptical. And I do it every day of the week before I go to work. And I believe, and my cardiologist believes, that it's thanks to that exercise and the meds that I am here today and did not have an additional event, because apparently it's very common in women at my age who have blocked arteries. So you find time for it. You make it. Sunday mornings, my girlfriends and I meet in Mohegan Park, and we're out there doing 4 miles every Sunday morning at 8 a.m. And they're a wonderful support group, too. We have time. We spend time together, but we spend time together moving. And I think that's an important message. Right. We're schmoozing, too. You have to be able to talk when you walk, right? You have to be able to talk. So we're schmoozing and moving, and that's the message to women that I like to give, that you can have a good outcome. All these things, I think Dr. Pina spoke about it earlier, about believing. Well, what drove me was high anxiety, fear, got me going in the first place, trying to eat right and exercise. And then the good result was self-reinforcing. And I could see that, wow, I do these things, I am okay. I can take control of this, and I can have a good outcome. And that's the message I'd like to see women receive. Do these things. It's not statistics. It's not anything. If you do it, you can overcome, and you can have good results.
I just wanted to say that one of the things, being the husband of someone who has heart disease, one of the things that's important is that there's a traumatic process that happens to your family members as you go through this process. Because my youngest daughter actually experienced my wife having an episode. And so I would encourage that as we talk about heart disease from their perspective, that we get another perspective on how we help children and how we help spouses go through this process as well. Because it, you know, it's almost, you know, is mommy not going to make it? So you have to reinsure them, and they need therapy, and we need help as we go through this process. Because when I met Nadine, I mean, she told me about it, and I was like, yeah, okay.
Didn't know what you were getting into.
Right.
By the way.
But I remember when that episode happened, I didn't have time to think. I remember we were at the hospital, and they called me in the room and said, and you know, the doctor was not very sensitive to the fact that none of us knew what he was talking about. And so I got on the phone, I called some friends that I knew, and it was the doctor. He said, he came in and diagnosed and said, okay, I'm leaving. Where you going? And so I had to convince him that you were not going to leave. You were going to be the one to do the surgery the next day. And I think I was very convincing to him because he stayed. But the point is that, you know, no one ever came back and told us exactly what took place. She's educated us over the years as to what she's been experiencing. And you know, I'm a kind of guy that, like, I push through anything. And I don't make my wife feel as though there's something wrong with her, because it's not. Let's keep it moving. Let's keep doing what you're doing and keep encouraging her to move forward, because if you stop, that's when it really takes effect. But family members don't know how to cope. I have one daughter that's in denial. If we really were to assess that she really understands, she really doesn't. And so I would encourage that if there was something, one of these symposiums could be done to include all of the family members so they can understand exactly what's happening to mom.
Thank you. And thank you very much, Wesley. That was, and I'll get to you, but you shared that your son, shortly after, who watched you being wheeled out, went to the nurse's office with heart symptoms just a couple of weeks later.
Yes, he thought he was having palpitations. He was actually 15 at the time, and a 5-year-old and a 15-year-old. And also the disbelief, my husband's disbelief when I said call 911. My son retold the story also, how, oh, Mother, I thought you were just being dramatic again or something. You know, I heard you asking Dad to call 911, and, you know, we know you're dramatic. And I think, why doesn't everybody just go to sleep? I have school tomorrow, whatever. And, of course, the tragedy that ensued that we overcame.
Tamiko?
I just wanted to piggyback off of something that I think Linda had said, but also he had said, also, I grew up with it, so it was never, it wasn't, it was very traumatic. My mom has had several open heart surgeries. My mom has had several strokes. I've seen my mom paralyzed. I've seen the side of her face droop. I've seen my mom come out with the tubes. I've seen the blood. I've seen everyone go running. So I kind of grew up in the ER and in the cardiac unit. But I think it's also important. Education is so important, because that's the way we can also, as a family, advocate. You know, my mom's doctors to this day, they know that they have to answer to me. I mean, and because I'm so subtle, you know, but, you know, it's even when she couldn't talk, when the tubes were in her mouth and she couldn't ask the questions, you know, it's very important that, you know, we advocate for them when they're not in the position to do that. And the education, I think, and I can't reiterate that enough, that to raise awareness is so vital, that we're educated so that we can have the proper questions and get the proper answers, so that we can not only support them, but that we can eradicate heart disease.
And I think that that is really the message. And for those of you in the media, any way that you can touch or craft a story that helps put a face on this disease will help us all. It will help these ladies. It will help the millions of women who don't know they have heart disease yet, but will. You know, it's their job to live each day as well as they can, as happily, as healthily as they can. It's our job in the healthcare profession, I think, to learn as much as we can and treat and research the best we can and give the best science information. And really, we depend on that partnership with the media to get the word out so that the rest of the people who don't know they have heart disease yet will be able to get great care and be cared for. And I really want to thank our panel members because this is a big deal to share. And I think you saw, and I feel like it's a gift that you've given us today. Thank you very much. And I just, on behalf of the Paley Center for the Media, NHLBI, and the Paley Center is here. I didn't know you were going to reappear.
I was just going to say how wonderful it's been, Sharon, to have Dr. Hayes and all of the staff, Chris Gotti and the people from the Mayo Clinic here. As I mentioned at the beginning, the Mayo Clinic is committed to creating a bridge and a dialogue between the media and medical professionals, and I think today's a good example of why and how important that dialogue is. So it's been a great pleasure for us to be involved, and thanks to each and every one of you for being here, and especially Dr. Hayes and our panelists.
All right. Thank you very much. We are adjourned.